Right. Hello, everyone, and welcome to today's office hours on COVID-19 planning and response. My name is Natalie Matthews. I'm with Apt Associates, and I'm going to give just a couple brief reminders and logistical pieces of information to get us started. So I just want to be very clear and reinforce that a recording of today's webinar is in progress right now. And that recording will be posted on the HUD Exchange along with a copy of the slide deck that we're going to go through today and a copy of the chat and the Q&A content that you all submit throughout the course of our time together today. Please give us anywhere between 2 and 3 business days. We're all working hard to get those up as soon as possible, but it does take a little bit of time. And if at any point you want content from any previous office hours, please go to the HUD Exchange link that's up there on the screen right now. I will post that in the chat as well in just a moment so you guys can click on it. But that is going to be your one stop for any sort of post-meeting materials from any of our office hours. Next slide, please. So everyone's going to remain muted for the duration of our time together today, and yet there is still an important way for us all to connect with each other, and we really encourage you all to please use the chat functionality throughout the course of the next 90 minutes. That's a wonderful way for us all to hear from you directly, for you to connect with one another, ask questions, have discussion about the content. You'll be looking at the chat throughout the course of our time together. So to get to the chat, please click on the, it's highlighted in red right now on your screen. It looks like a little message or a chat bubble. If you click on that, it will open up the chat functionality for you on the screen. And please make sure that you click on all participants. It should default to that for you, but if it doesn't, please just scroll down in the menu and look for all participants. That is the way for it to reach all panelists, all presenters, all attendees, so all participants. That's the button to click on. And then lastly, just a quick reminder that if you do get a message that you would like to look at, you'll see like a little orange bubble, and that will tell you you've got a message that's on red. And if you're like me and would like to see this chat functionality a little bigger on your screen, you can go ahead and click on the arrows that are off to the left-hand side of it, and that'll make that bigger for you. So please be sure to do that if you need to. I'm going to now turn things over to Norm Suchar, who's the director of the SNAPS office. Norm?
Thank you very much, Natalie. So I quickly want to introduce some of the people you'll be hearing from today. From HUD, you'll be hearing from me, from Erin Weaver, who's a representative, senior representative in our Chicago field office, Marlisa Grogan, who's our subject matter expert on infectious disease and DSG, William Snow, one of our senior analysts in the SNAPS office, who's going to talk about the eviction moratorium. We'll be hearing from Emily Masitis from the Centers for Disease Control and Prevention with some updates, and we have a couple speakers from Department of Veterans Affairs, Jeff Quarles, who is the director of the Grant and Per Diem program, and John Kuhn, who's the director of the SSVF program. So moving on to the next slide, I think I've kind of given away our agenda already. One thing I will say is if you we're going to start off with an update from CDC, from Emily from CDC. She's going to have to drop off at about 3 o'clock. So if you have any questions for her, please feel free to go ahead and submit them to the chat box while she's presenting. We'll do a quick Q&A with her after she is done with her presentation before we move to the other speakers. So Emily, take it away.
Thanks. This is Emily. Can you hear me?
Yep, hear you great.
Great. This is Emily Masitis with the At-Risk Population Task Force at CDC. Just going to give you a very brief update today, and then we'll take a couple questions right away. So next slide. So as of yesterday, over 630,000 cases reported in the United States. We're very much in the middle of the big wave of cases coming through the United States. This map looks a little different than the maps that I've presented in the last, couple weeks. They recoded the coloring, so it had been looking darker and darker, but now we have these clear areas with the darkest colors with the highest numbers of cases. Next slide. So my primary update today is really that we have we have a small change or an update to the shelter guidance. So on the website, if you go to this address, it'll say what the update is in a little box at the top. And then you can just scroll down to the area that talks about staff PPE. And it really just clarifies the types of situations where staff will want to be using PPE. And there's also more information on cloth face coverings, because we are recommending that within a shelter, when there's interaction between people, that everyone should be wearing cloth face coverings. There are very important caveats to that. Those cloth face coverings should not be used by any children under 2 or people that have compromised breathing, that it might be dangerous for them to be wearing something covering their mouth and nose. So that's the primary update I want to let you guys know about today. And I would be, if you want to go to the next slide, I'd be happy to take any questions. Again, this is our inquiry phone number if you have questions that you have about the guidance or other things related to CDC information. Thanks.
Thanks, Emily. So we had a question from Eleanor on the chat box about moving people into 2-bedroom units where one of the units is currently occupied. I know all of these things are sort of about balancing risks and everything, but can you talk about what you'd recommend for moving people into a shared unit, shared apartment where they each have their own bedroom? And would you recommend that for people, coming out of emergency shelters or who are sort of, ending their quarantine time in hotel rooms or something like that?
Thanks. So it is a little bit hard to know the specifics, if we're talking about someone that's confirmed to be moving someone that's confirmed to be positive into those rooms, or if they're at high risk. So there are, just like you mentioned, we want to be balancing the risks. But on the whole, individual rooms in general are going to make it easier for people to be able to be more isolated, just like in a house, a regular house or home or apartment. It's easier to remain isolated and socially distant in those sorts of situations. So without knowing the full context, I can say that, if you have a 2-bedroom apartment and let's say you're just moving some people in there for overflow or something along those lines, that sounds very reasonable.
Okay. And so there's been a lot of discussion in the news about sort of the prevalence of COVID in some emergency shelters and how a lot more people seem to be having it than I think maybe some people expected. Could you talk about, like, are you looking at that information, and do you have any sense of should people be adjusting their sort of strategies here, or do you have guidance coming out? Can you talk about, like, how we should be thinking about those kinds of things?
Yeah, I think that some of the information that's coming out, some of the data that's being published about the number of people that have asymptomatic infection is really important. And we need to think about what our kind of baseline posture should be. At baseline, we want to assume that everyone's infected. And so that's what we want. That's why we're doing all the social distancing. That's why we're recommending cloth face coverings, because if we just assume, that everyone's infected, we want to make sure that we have distance between everyone. So yeah, we want to just keep, well, not everyone's infected, because technically if everyone was infected, we wouldn't really be bothered about protecting. We want to assume that we don't know who is infected at any time. And I think that those data really re-emphasize that we do not know who is infected at any given time, and we need to be acting as though anyone could be. So yeah, so that really, I think that's going to be really important, and thinking about that going forward. is going to be really important.
And sort of a related question. So, and this is also in the chat box. If there are people who have already been confirmed to have COVID-19, maybe they're asymptomatic or maybe they've sort of had symptoms but they've subsided, are they okay to go out in public safely? What kind of guidance would you recommend for people when they're either the people who work at the shelter or some of the shelter residents have confirmed COVID-19 and again are either asymptomatic or maybe have gone through their symptoms already?
Yeah, that's a really good question. So there's information. It's a linked. I'm trying to think if it's linked in our guidance on the homelessness landing page. It might not be, but I can send it around if it's not. There's information about when to discontinue isolation if you have tested positive. So that guidance talks about it needs to be 3 days since your last fever or symptoms and at least 7 days since your positive test to discontinue isolation. There's also an option for doing testing-based discontinuation of isolation, which would mean that you would have negative tests to discontinue that isolation. But of course, that's only in the context of there being a wide availability of tests. And then if someone is asymptomatic, the isolation is supposed to be 7 days since at least 7 days since the positive test. So I'll certainly send that around because I want to, of course, make sure that I'm quoting that correctly. I'm quoting it from memory, and that you all can reference that because that's going to be very important when we have these isolation sites and we want to know when people can leave them. So that is an important thing to be thinking about. Later, whenever there's more availability of serology testing, there might be uses for that, but at this point, it's not widely available.
Mm-hmm. And it looks like David already posted that document in the chat box. So if anyone's interested in that document, again, it's posted in the chat box. Thank you, David.
Thank you.
Great. So thank you, Emily, for your time and for the incredibly helpful update. And we're going to move on to our next presenter. William Snow from the SNAPS office is going to present a little bit about the eviction moratorium and how it relates to continuing care and ESG programs. So William, you're up.
Okay. I'm excited to be on. So we're hearing more and more about evictions in the news. So we want to talk a little bit about what the CARES Act federal eviction moratorium is. So the CARES Act moratorium is a temporary moratorium on eviction filings for non-payment of rent. So that's pretty important. It covers several federal assistance programs, including many that are funded through HUD, certainly the COC and ESG program and HOPWA. It also covers those who are in properties that were funded through federally backed mortgage loans. So often you or your recipients are not going to know that information. We'll touch a little bit on that later in the slides, but it has a pretty broad reach. So next slide, please. So the core purpose of the moratorium is certainly to help fight against the health consequences of COVID-19, also to help stabilize renters. We obviously know that that's going to be one of these things that we face as we get over the COVID-19 spread is we're still going to have the pain of the economic fallout, and this is hopefully going to be something that helps us to overcome that. Next slide, please. So here are a few of the details about the moratorium itself. So it begins on March 27th, 2020. That's the day that the CARES Act was signed. And it extends for 120 days. That would be until July 24th, 2020. There are a few things that it does not necessarily cover, right? So it is for non-payment of rent, which means it does not cover no-cause evictions. It doesn't cover eviction lease violations like criminal activity. So just want to make people aware of that. It also doesn't cover evictions that were instituted or started prior to March 27th. However, it does apply to any new fees that might have been applied during this period, essentially pulls in the event. So they can't add more fees for the time during the eviction or moratorium period. Next slide, please. A couple other things to bear in mind. So what exactly is it? The moratorium is no new evictions for non-payment of rent in between that time period. It covers fees and penalties and other charges associated with the non-payment of rent for these covered properties. And again, it pulls any even previous penalties that would have been incurred or for non-payment of rent. It essentially pulls all fees and charges during this period. It disallows any or prohibits any issuance or notice of vacating. So we can't do any sort of eviction notice during this 120-day period. And they can't begin providing those type of notices until after the moratorium period is over. So they can issue 30-day eviction notices starting July 25th. They can't issue those before that. And those notices have to be a 30-day notice. Next slide, please. So there are a few things that we want COCs to consider in all of this. One of them is just bear in mind that those you serve are covered by this, by virtue of the continuum of care program, the or HOPA programs. Please let them know that, especially if they're receiving homeless prevention. They may not be aware that they're covered as well, but all of those receiving assistance for these programs are covered. It's important to note that legal aid in many areas is on hand in helping with this. We encourage you to connect with them. We've seen a lot of positive action on their part, clarifying what's allowable and what's not. Remember, this covers all evictions, not just those performed through law enforcement. We see landlords are taking their own action on eviction. That's also prohibited. There's nothing that says it's only for evictions instituted through law enforcement, with no evictions for non-payment of rent. So it may be good to inform people of that. If you see landlords taking action, they need to know that that's not appropriate or allowable. Our clients, we need to know, those who we serve often aren't aware of basic things like what subsidies are tied to them. And those are things that some will know and some will not. So don't assume that they know that. Inform them anyways, please, that they have protection under this moratorium. And like most of us, we generally don't know how our landlords funded their properties. So we don't know what federally backed mortgage loans that they use. So if an eviction notice comes up, please encourage your clients or even the legal aid team to help clarify that if there are those federally mortgage-backed loans tied to the property, they can evict, or if you, as clients or your clients are tied to this, that they can't perform these actions. So we want to protect those we serve and provide as much protection as possible, and a lot of that will happen through just providing information. All right, thanks, Norm. Back to you.
Thanks, William. And I know the audio was a little hard to hear for a lot of people. I will say we are putting together some materials that we will post on the HUD Exchange that follows along with William's presentation and has some Q&A information. And if you have any questions as a follow-up, please go ahead and stick them in the chat box, and we will get those answered as quickly as we can. So with that, I want to turn things over to Aaron Weaver. He is one of our CPD reps in our Chicago field office. So Aaron, take it away. You may be on mute there. Oh, there you go. Yep.
Oh, perfect. Thank you, Norm. So we're going to go over a few of the highlights from the mega waiver presentation that occurred this past week. The first one is related to disability documentation for permanent supportive housing. The waiver in the memorandum, which was issued on March 31st, provides for a 6-month period where you are not required to collect the disability documentation in person. The way it can be done is you may ask clients to provide a self-certification of disability that they then send to you electronically. This could be in the form of an email or a handwritten note that they take a picture of on their phone and send to you. These would be acceptable forms of documentation for that. The thing that I think people have had some questions about regarding the wording in the memorandum is that the applicability section of the memo states that it is for a 6-month period, whereas the note in that underneath that waiver states that it's based upon when a public health official has determined that no additional special measures are necessary. Essentially, what we're doing is we're providing a waiver for the 45-day period you have had to collect disability documentation. That is for 6 months. But until public health officials have determined that it is that no additional special measures such as social isolation have to take place, then until that time, we will accept self-certifications. Next slide, please. So we also want to provide you with the types of documentation that you can maintain on site in order to ensure compliance. So that way, when you have a HUD inspector come out and look at your files, that you will have everything you need from your use of this waiver. So first and foremost, and this goes for every waiver in the memorandum, you want to ensure that you have established record-keeping protocols and policies and procedures for this emergency situation. I understand that that may be an additional burden for folks, so we are trying to develop a set that we can provide, and I would highly recommend you reach out to your local HUD field office. They may be able to provide you with a template or something that you could use for that to expedite the process. You also, in the availability section of the memorandum, will note that it says you must document the justification of your use of the waiver. So while you're not requesting to use the waiver from HUD, you're notifying us, you do have to still maintain documentation justifying your use of the waiver. So the first thing that you want to ensure that you have is documentation regarding that justification, a copy of the notification you sent to HUD, and the emergency record keeping protocols. And in terms of the justification for this specific waiver, you want to identify the constraints that have prevented you from gathering that documentation and purpose. This could be a shelter-in-place order. It could be staff reductions because of the various COVID-related activities. So that's the type of item that you can look for number one. And then in the client file, in the individual client file, again, with every waiver in the memorandum, you want to ensure that for those that affect clients specifically, you have a note to file outlining that this was the waiver that was utilized and the client is clearly identified on there. And then you want to keep copies of the certifications. All of this documentation that I'm going to mention, just to clarify, can be maintained electronically, and we highly recommend that you maintain a backup copy of that documentation to ensure that you can meet your record-keeping requirements in the event of a natural disaster or some other damage to the originals. Next slide, please. So with the ESG mega waiver, the ESG waivers in the memorandum that was issued on March 31st, there are four. The four primary ones for this, the HMIS lead activities, which allows the non-HMIS lead entity to spend ESG funds on updating the system. The reevaluation for homelessness prevention assistance, which was also waived, and the stability case management, that one, just to note, it's a shorter time period than some of the other waivers. This one, I believe, if I recall correctly, is for 2 months. And that one, you want to make sure, we're trying to be understanding in terms of those additional constraints that you have on the ground, but we want to ensure that we're providing services to clients. You may ask, can we provide them remotely over the phone? Case management can be provided over the phone. Again, you want to make sure you document these things in the client files. And then restriction on rental assistance below FMR. So you can exceed FMR as part of the waiver outlined in the memorandum that was issued on the 31st. Now, in terms of what you can expect moving forward under CARES, there are some additional flexibilities that have been provided. First, there's no matching requirement. The spending cap on emergency shelter and street outreach has been lifted, and you can spend up to 10% on administrative activities. You also can qualify people for homeless prevention if they meet the 50% area median income eligibility criteria, as outlined on HUDuser.gov. It allows deviation from applicable procurement standards. We're hoping to see more guidance related to that once the Federal Register is issued. And then the Housing First provision. You can't require a participant receive treatment or any other activity before receiving assistance. The last two items here, citizen participation and consultation. So we want to make sure that we keep these separate from the waivers that are outlined in the memorandum. This is under CARES Act, so the CARES funds specifically, the ESG-CV grants, will receive citizen participation and consultation requirement waivers, and there is no minimum use period for emergency shelters. There is also, if I recall correctly, a waiver. There's a few items in there that you want to take a look at regarding temporary shelters and environmental regulations. So those are the main ESG-related components. Next slide, please. Then for consolidated plans, so especially, again, for the ESG recipients in the audience, your citizen participation plan requirements. Through the end of your 2020 program year, the 30-day requirement for citizen comment on any substantial amendment to your plan can be waived so long as you provide a minimum of 5 days for the public to comment on those changes. So that's through the end of your 2020 program year. Next slide, please. And in terms of the documentation you need to maintain on site, again, the waiver a copy of the waiver notification that you sent to HUD. And just to reiterate again, you are not requesting use of the waiver, so you're not waiting on the local field office to respond. You can use that waiver 2 days after you send in the notification. That is the only requirement, other than the documentation requirements that I already outlined. Then you want to make sure that you maintain records demonstrating that you met the 5-day minimum comment period. All copies of comments need to be submitted to the field office as part of that substantial amendment in the IDIS system and your responses to those. And finally, your emergency record keeping protocols and policies. Next slide, please. So there are two con-plan waivers outlined in the memorandum, and I know there's been some confusion as to what the difference is between the two, right? And I know Norm and I were talking about this on the office hours call, I believe it was Tuesday. Essentially, you need to view it as your citizen participation plan governs how you are to update your substantial amendments. So any substantial amendment is governed in part by 24 CFR Part 91, but then also by your citizen participation plan, which is developed locally and meets the requirements in Part 91. One of those requirements is what is deemed reasonable notice or opportunity to comment. So you need to update your citizen participation in order to then submit the plan, submit the amendment to your plan, right? The amendment to the citizen participation has to happen in order to do a substantial amendment to the plan. These can run concurrently, so you don't have to wait until the 5-day period on the citizen participation plan amendment is in effect before you can then make your substantial amendment to the consolidated plan. They can run concurrently as they can also with the 2-day notification period that you have to wait for the field office. So to give you a brief example and hopefully clarify any questions, if you send in your notification to the HUD field office that same day, you can submit an amendment to your citizen participation plan and your consolidated plan substantial amendment all together. And then 5 days thereafter, you would meet the requirement and the waivers and would be able to continue on. Next slide, please. And with that, I'm going to hand it on back to Norm.
Thank you, Aaron. There are a couple questions came up that I want to just pause and ask you while we're on the topic. I think going back to the waiver on documentation of disability, I think there's some confusion because it's already a complicated requirement, and so people are unclear about what we're waiving. So the question really comes down to, if you waive the requirement of third-party documentation, so let's say you do self-certification, is there any time you ever have to go back and actually get that third-party documentation? Like after all the public health emergency stuff is over and all that, do you then have to at some point go back and obtain third-party documentation?
Yes, so that's a good question. Essentially, no. The waiver provides you the opportunity for any client whose intake occurs during the waiver period. You do not have to go back at any time to try to obtain that third-party documentation. The self-certification is sufficient to meet that standard.
So 10 years from now, still no need for documentation, to be clear.
Correct.
Great, thank you. And then someone asked, and I'll just go ahead and answer this one. Someone asked if this also applies to transfers from one permanent supportive housing project to another. Yes, it does. Most of the time you don't really need to do that because it's already been done on the at the initial intake, but there are some weird cases where that may not have been the case, and the same standard applies there. Thank you and Aaron, one other question was, I think at some point you talked about the process for requesting or to notify the field office that you were going to use a COC program waiver. Is that also the same process for ESG?
Yes, so all of the waivers that are outlined in the memorandum from March 31st all fall under the requirements in the attachment for notifying the local field office. So make sure you check that attachment, send it to your local field office director and the email that's outlined on hudexchange.info, and then you will meet those requirements. Great,
thank you very much. And we'll get a copy of the memo and post it in the chat box, so if anyone's interested. Aaron didn't go over all of the specific waiver opportunities, but you can look in the memo and you'll see those there. But if you have any questions about them, feel free to go ahead and keep submitting them in the chat box. So next I want to talk about, can we actually go to the previous slide here? I want to talk a little bit about communication strategies during COVID response. One of the things, we sort of hope everyone understands is that everything is constantly evolving. This is certainly something we've noticed, is that, it's hard to imagine, but, we just really started working at home about a month ago, and this all hasn't been going on that long, but there's so much that's changed. It's just really important to establish a consistent communication among the stakeholders in your community. Make sure that everyone is aware of the resources available through the COC. The COC is obviously a good body to coordinate oftentimes. We know that in some communities, ESG is sort of separate from COC, and there's coordination required, but sometimes not the strongest partnership. Given the amount of resources and everything that's going on, this is really a crucial time to build that partnership and strengthen it as much as possible. It's also really important to do outreach to all the various stakeholders who are engaged in this stuff. This is going to be really important for making sure coordinated entry is working well, that sheltering operations and how sort of sheltering works is optimized. So just want to sort of point out the need to really widen our net as much as possible. And then wanted to make you aware of an infectious disease toolkit. There's a link to that in here. We will also get a link to that for the chat box, so it's a little easier for you to cut and paste or open up while the session is going on. Let's move to the next slide. We've talked about this before, but always bears repeating. SNAPs, we get that your number one priority right now is responding to COVID, and it very well should be. I know people have asked about if there are any updates on the continuum of care competition. Unfortunately, I don't have any updates. As I've mentioned before, we are definitely working on what our options are and trying to find an option that will cause the least disruption possible. We will certainly get that information out as soon as we can, but unfortunately, I don't have an update yet. We know that everyone's focused on performance and doing all the things that a COC has to do, monitoring subrecipients and such. We know that this is just not the time to focus on that, and COVID response is the #1 priority. And if your COC doesn't sort of do its meetings or whatever for several months, we completely understand that. We have also tried to extend deadlines as much as possible to make it easier to, again, focus all of your attention on COVID-19 response. And we're definitely going to take this into consideration in future evaluations of performance and looking at future competitions or other kinds of things where we've focused on performance in the future. And we definitely want you to do the same, understanding that when we do have a COC competition, whenever that is, that you are also thinking about, well, what's the right way to evaluate the project and to do our local ranking, given that there's so much stuff that's happened and people have really needed to respond, and also reward people who really stepped up in this time. So with that, I want to shift gears a little. We're going to turn to our partners at VA. So pleased to introduce John Kuhn from VA, Director of the SSVF program. So John, you're up. Take it away.
Great. Thanks, Norm. Appreciate you bringing me on the call today. I wanted to be able to review a little bit about what SSVF is going to be providing over the next 6 months through the end of the fiscal year to grantees to be able to help support what's going on with the COVID-19 pandemic. Go to the next slide, please. So we are distributing just over $201 million over sometime over the next couple of weeks to all renewal grants. These additional funds will go out to all grantees. It's approximately a 53% increase to renewal awards. Those funds will be used for 3 main purposes. The first is to expand the emergency housing capacity. Second is to expand prevention services. And the third is to try to support HUD-VASH placements where PHAs are not fully operational. Obviously, everyone is aware of the PHA limitations right now with lockdowns to be able to provide HQS and issue vouchers. In those situations, we want SSVF grantees to be able to secure those apartments, provide the rental assistance that's necessary, while HUD-VASH staff will continue to provide ongoing case management. And this way we can continue the placement process and not lose these apartments. On all of these areas, for emergency housing prevention and these HUD-VASH placements, we want our grantees to work closely with area providers and with the COC. Clearly, ESG is getting a huge influx of resources as well. So coordination is going to be really important here. Next slide, please. Some of the Stafford Act changes that allow us to expand our emergency housing is that there's no longer a 45-day limit for emergency housing. That used to be the case prior to this crisis. This allows us to be able to bring people in, recognizing that for a number of grantees, it's more challenging now to make these placements. The placements are more challenging, of course, because our grantees are also impacted by the lockdowns. Housing navigation is more challenging, and we know that sometimes these 45-day limits would need to be exceeded. The goal is still permanent housing, but we do expect that for some grantees, it's going to be necessary to extend the length of the emergency housing. SSVF also had a 72-hour limit for individuals. The idea was that for individuals, they would be able to go to GPD or HCHV. Our goal, though, is to keep people out of congregate environments. We want to be able to, for vulnerable veterans, to be able to place them into hotels or motels and keep them in a safer environment. By our data, we see approximately 2/3 of all veterans served by VA Homeless Services fit into the CDC's definition of vulnerability. So the vast majority of our veterans do have risk or higher risk if they were to get COVID-19. We're also wanting to be able to expand that emergency housing so that it can serve not just vulnerable veterans, but also veterans who may be unsheltered and other risk groups. The final waiver I wanted to mention was that we are also, for rental and utility assistance under SSVF, the number of months that are allowed for grantees to provide that assistance is also lifted. So there's no limit if we have people who are coming to the end of their assistance under rapid rehousing, they can be continued, or if we have people who have been recently discharged but are at risk now because of employment situations or other factors, they can be brought back on even if they've exhausted the rental assistance and be served as prevention candidates or households. Next slide, please. For emergency housing, we expect our grantees to expand capacity at this point. As this new money comes in, there will hopefully be a rapid ramp up of emergency housing through hotels and motels that are going to be available to veteran households. We want those initial placements to prioritize vulnerable veterans, but as I mentioned, we also want to be able to make sure that unsheltered veterans are served. This is a real opportunity with these additional funds to prevent folks from coming into environments that are dangerous, and certainly unsheltered are always at risk. It's also an opportunity to provide self-quarantine. So if there are veterans who need to be quarantined because either they're entering programs or other environments where it's unknown what their status is, they can be placed for 14 days for self-quarantining. They would still need to be admitted to SSVF, but they could be admitted just for that purpose. We want to be sure that all veterans who are placed in these hotels are supported. We are allowing our grantees to supply phones where that's necessary. For many hotels, of course, there is phone service in rooms, but where there is not or where special conditions exist, grantees can purchase inexpensive disposable phones for households so that there's an ability to check in and provide support. We've lifted the $500 maximum on food assistance for grantees to provide to veterans. Certainly, it's going to be somewhat challenging. Some hotels don't have really adequate access to food. We may be able to do, or our grantees may be able to develop relationships with hotels where there are food plans included if those hotels have kitchens, for instance, or some other resource, perhaps purchasing microwave ovens, but to really think creatively and how this food will be provided, delivery as well, delivery services, but ultimately that $500 limit, if it needs to be exceeded, can be exceeded. We know from a recent study from Dennis Culhane that something like 40% of all homeless persons are going to be infected at any point during the COVID crisis. So this really talks to the urgency of these placements. We need to make sure that first and foremost, we are placing veterans in a place where they can be safe. That's why this emphasis on emergency housing, that maybe not every detail is going to be worked out here initially, but we want these funds to be put to use, and we've provided a significant amount of guidance and flexibility on compliance and documentation during this time, so we can really place the emphasis on getting veterans and households and their households into a safe environment. Next slide, please. For prevention, other guidance we've provided is what we had been using to target is what we describe as a stage 2 screener. For those of you who are familiar with it, it assigns a number of points. It's based on research done by Mary Beth Shin that helps to get a greater percentage of those who are at risk who would actually become homeless into prevention services. We're eliminating that stage 2 screener. So we just use a stage 1 screener, so with a sort of a bigger pool that we can serve. We know from estimates from the Federal Reserve that unemployment could hit 32%. So rather than seeing massive influx into the system of homeless persons, which we cannot accommodate and would put them at significant risk, we want to make a big safety net around people, even if they have eviction prevention or moratorium. Even if there's an eviction moratorium, our grantees can step in and provide assistance. The thinking is that assistance for rental assistance will free up limited funds that might be available to that household to pay for food and other necessities. So our grantees can pay for homeless prevention even if there's an eviction moratorium in place. We have waived the 40% maximum that is allowed on prevention. In fact, we expect most grantees now to spend most of their TFA on prevention given these waivers. We've also lifted the 50% waiver maximum on the amount of financial assistance can be used in any budget. The likelihood is that most of the money of this $200+ million is going to go to financial assistance for things like rental assistance. Finally, we're allowing the emergency housing assistance is how we pay for our diversion, what we call rapid resolution in SSVF. So those rapid resolution funds, which use our emergency housing, can be paid to host families in again, uncapped fashion. Prior to this, it was limited to 1 month. So we can lift that limit. We want to use any resource that is available to us to prevent people from entering the homeless system. If we can connect to host families, whether that's family, friends, or previous connections, we want to be able to do that and divert people from entering the homeless system. And I think that's my last slide. Yes, it is. If there are questions about this, we encourage our grantees to reach out to their regional coordinators. You can also contact ssvf@va.gov, and all this information is on our website at va.gov/homeless/SSVF. Thanks. Back to you, Norm.
Thank you very much, John. And now we're going to turn things over to your colleague, Jeff Quarles, who's going to talk a little bit about some grant and per diem updates. Jeff, are you there?
Yes, I am. Can you hear me okay?
Yep, you sound great. Thanks.
Okay, thanks. So I wanted to take a few moments to give an update related to the CARES Act. But before I did that, I wanted to point out that we have a good deal of information related to COVID-19 and grant per diem's response to that on our GPD provider website, www.va.gov/homeless/GPD providers website.asp, and I'll get that in the chat box before we end. One of the reasons that I suggest folks go there is we have information around the CARES Act implementation, some of the stuff I'll be talking about today, information on isolation options related to a grant per diem, looking at means to do social distancing within the programs and isolation when needed. Obviously, we have a lot of congregate living settings within our transitional housing. We're working toward getting space with folks, getting people into hotels, looking at other spaces that they have available to support social distancing and ensuring people are safe. We have some guidance specific to COVID-19 planning and preparation, specific for grant per diem programs. There's a recorded webinar that we did with CDC, HUD, USICH for homeless programs in VA in planning and preventing COVID-19. So there's a lot of information that is there, and we update that on a regular basis. So we encourage you to get to that site, and I'll make sure when I'm done with the discussion here that I get it in the chat box for folks as I see a request. Oh, there it is. Folks got it up for me. Thank you. I appreciate that. So that information is available. It does get updated pretty frequently, so we encourage people to go back to it pretty quickly and frequently. We do have one particular update that I wanted to speak to it in relationship to the CARES Act. There are a number of things that are identified in the CARES Act that relate to grant and per diem. One of them got enacted last week. Another portion we're hoping we'll be able to make an announcement to very soon, which is another reason to kind of watch the website. There were a couple of requirements within the program that are waived within the CARES Act. One relates to the requirement that if someone was gone for a period of 14 days, that they were discharged from grant per diem. The other really related to limited our ability to pay for a veteran who was absent for more than 3 days from the program. So there are some waivers there specific to a couple of circumstances. For a veteran who is been required to go into a more intensive level of care than offered by GPD, let's say someone is hospitalized or going to one of these quarantine sites for care, or they happen to go in the hospital while they were in a GPD for any particular reason and happen to be absent, we will not require the person to be discharged because we want them to be able to come back to the grant per diem program. Also, if a veteran happened to consult and leave the grant per diem program, let's say gone past to visit family or go help them out, and ended up getting quarantined or required to shelter in place, those circumstances are also waived for persons to be discharged. The requirement for the grantee is that there's a reasonable expectation that the veteran return. There's some required contact that needs to occur between the grantee and the veteran on a periodic basis, and certainly to keep at least monthly contact with the grant per diem liaison to make sure VA is aware of kind of what's going on. As far as per diem payments go, that during this public health emergency, we're basically able to waive the 72-hour absence periods for ending per diem payments. Basically, again, if the person was in a more intensive level of care as described, or if they were, approved to be away and ended up, getting stuck because of quarantine or shelter in place, or we've had some folks who were deployed during that period and couldn't get back because they were in the reserves or whatever, that would be another reason. We would continue to be able to pay per diem as long as the agency is willing to hold the bed. We also recognize that during this period of time that we have some folks who have some significant challenges, folks who are chronically homeless, had some mental health or substance abuse issues, who may go into crisis and kind of walk out of these programs, kind of go AWOL. Typically, if they were gone for more than 24 hours, we ended per diem payments in these particular cases. Now, if they're gone, we give programs up to 7 days to try to get in contact with them to re-engage them. So basically, we can continue to make per diem payments. The expectation, again, is that the person has a reasonable expectation that they're going to, come back. There's an expectation for some follow-up that's done with the grantee, with those veterans who are gone on these absences to be able to continue to receive per diem payments. We're asking that for some reason, if it ends up being, really extended and they're gone for like a month, that there is some ongoing conversation and reevaluation of the case with the grantee and the grant and per diem liaison at the VA. And this period of extended funding while people are absent, as long as these conditions are met, is unlimited. Basically, we want to make sure that there's the opportunity to reconnect with the veteran if they're going to actually come back to the program. We encourage folks to continue to have conversations locally. Also, we've been updating both the grant per diem liaisons and grantees as often as we can. So this information keeps changing. I want to reinforce something that Norm mentioned a little bit earlier. We know that you're focusing in on COVID-19. We don't want people stressing out about performance measures. I think that was a really good point. I really appreciate you sharing that, because that's one of the things that we're concerned about as well. And we're working on maximum flexibility as much as possible during this period of time, and that we're here to help. And I think I'll pause there, Norm. Back to you.
Great, thank you very much, Jeff. So we're going to just shift to our Q&A portion of the conversation. And I'm going to start with a few HUD-related questions. So there's an HQS-specific question, and Aaron, I wonder if you might know the answer to this. But the question is about, so there has to be an HQS sort of certified inspector that sort of does the HQS inspection. So you talked about the fact that you can do HQS inspections virtually. So does the HQS inspector have to be the one taking the pictures or the video, or can they just review that stuff and sign off on it? You may be muted.
Have to be.
Oh, there you go. Yep.
So the inspector does not have to be the one taking the photos or recording the video. They merely review those items that have been sent. And we noted on the last office hours call that you want to make sure that there is a date either verbally acknowledged in the video or on attached to the photo or somehow embedded in the video, so that you can ensure that that date occurred relatively recently and wasn't, when the property was first constructed. But they do not have to be the one actually conducting those or taking those photos.
Okay, so in the old days, you'd hold up a daily newspaper and show the image of the newspaper. That was, I guess, when we had print newspapers. But great, thank you. And there have been several questions, Aaron, still with you, several questions for subrecipients wanting to take advantage of waivers. So if a subrecipient wants to take advantage of, say, an ESG waiver, does the subrecipient have to notify the field office, or how does that work?
So the way the memorandum is written in the availability section, it speaks specifically to the recipient. So what a subrecipient should do is reach out to their local entitlement jurisdiction or the recipient of the ESG funds, and they will then submit the waiver notifications. You want to coordinate those efforts. Everything is going to largely be governed by the subrecipient agreement you have with that entity. So the entity itself would be the one submitting the waiver notification.
Great. And does the subrecipient have to do anything? Like, do they need to? Can they just sort of once the recipient keeps the stuff on file, they're fine, right?
So they want to make sure that they work closely with the recipient to develop whatever emergency policies and procedures are going to be used to implement the actual waiver, because you want to make sure, especially on the client level, that you're maintaining documentation that meets the requirements that we outlined for each waiver, so that way when your recipient is monitored, you can provide those documents and you meet the record-keeping requirements. Again, those are probably stipulated in your subrecipient agreement.
Yeah. Great, thank you. So we have a question, and so I'm going to send this one to Brett about hotels and motels. So this questioner says they work at a DV shelter, they operate transitional housing and permanent housing, and at the transitional housing, and some of the transitional housing is sort of commingled with their shelter beds, and they have a COVID case at their shelter. So can HUD cover can HUD cover a motel or hotel stay for someone who has tested positive or is showing symptoms of COVID, rather than sort of creating a new isolation or sending someone to an isolation program? You can imagine a DV program where confidentiality is so important, they may not want to send people to a more publicly well-known isolation center. So how can you use hotels in that context?
Right. So right now we've said that COC funds cannot be used to pay for hotels or motels. Those are considered emergency shelters. So you wouldn't be able to use your COC money to pay for a hotel or motel room. You can use ESG funds to pay for hotel and motel rooms for people who are experiencing homelessness, and I would make the argument that somebody residing in transitional housing also meets the definition of homeless. Where there's no available or appropriate shelter, I think is the way that works. And certainly if someone is testing positive and needs to isolate and has some other safety considerations, that might be a good use of ESG funds.
Great, thank you. We do have a question asking about the 50% income limit because ESG funds for prevention can be used for people up to 50% of area median income, and William helpfully just posted that. So you can click on that link, select your geography, and that will tell you what the very low income limits are. Just make sure you're looking at the data set that is for the 50% area median income or the very low income, because I think at that link you can also find extremely low income and low income thresholds. Great, thank you for that, William.
I'm pretty sure we're also updating the income calculator so that will be done automatically for folks.
And that's the income calculator that people can find where?
I will find a link for that and put it in the chat. It's not updated yet, but it will be. Okay,
great. But it's on HUD Exchange, right? It's something we post for our recipients to.
Yep, it's the CPD income calculator that folks use for other CPD programs as well.
Great, and here's a question I don't think I've seen before. So Brett or Marlisa, maybe you could, actually I'll ask Marlisa, maybe you can take the first crack at this one, but this is specifically asking about CDBG funds, but I wonder, and I'm not sure we know the answer to that, but I wonder if we could talk about it in the context of ESG and COC. But the question is about vehicle modification to transport people who are COVID positive. Is there any way to use ESG funds or COC funds to, say, modify a vehicle to put maybe a screen between the front and the back or whatever would be needed, and to pay for that kind of modification? Marlisa, do you have any ideas?
That's a good question. And I don't think that we've ever talked about that, but it's a really good idea. I'm going to have to put a pin in that one and get it out or basically discuss and provide guidance on that.
Great. Brett, do you have any ideas? This is a good stump the SNAPS team question. David?
I just wanted to throw out there, and I was answering this one in the chat while you were asking the question. So, transportation for COVID positive individuals is a systems need for lots of different situations in your community. And likely emergency management and public health folks should have or should be in the process of developing resources or assets for use in a lot of different situations. So before we would tap special, unique homeless funding to accomplish that goal, I just would want to make sure we were in sync with other partners and tapped into those networks first.
Great, thank you. And Brett, any ideas?
I'm with Marlisa. I want to put a pin in it and see if we can't thread the needle in our existing regulatory language.
And just one other comment, in addition to what David said about making sure that you're following the coordinated response being led by public health and emergency management, it's also really important to get feedback from public health and other medical professionals when trying to implement some infection control measures, such as vehicle modification, to make sure that you're doing it the right way. And, even a lay person trying to do that, you may not be doing it the way like a medical professional or an infection control specialist would prescribe, that sort of thing. So that's another reason to be in touch with public health.
That's a great point, Marlisa. Thank you. Another question, Marlisa, for you about sort of related to the eviction moratorium, and that's about if we're documenting at risk of homelessness status during the eviction moratorium, is there any change in the way people should be documenting that at risk of homelessness status?
Yes, and William had pointed out that that an eviction notification can't be given until, I believe it was 30 days after the end, or it can't be effective until, William, you can correct me on this. But that timing is really critical because within or prior to the effective date of the eviction moratorium, your client is not going to be eligible for homelessness prevention. So for eviction type situations, your program participant or your applicant for assistance would need to be eligible under Category 2 of the homeless definition, so losing their residence within 14 days, or the at-risk of homelessness definition under Category 1, risk factor C, which would mean that their right to occupy their current housing would be terminated within 21 days. So that time period needs to be in sync with the eviction moratorium. So if you have a program participant who presents after the moratorium took effect, they have to be, they're not going to be eligible until the moratorium has concluded, and they know that they're going to be, that the eviction notification is effective within either 21 days or 14 days, depending on which category they fall under.
Great, thank you. And to be clear, the 14-day standard applies to the COC program because that's the Category 2 of the homeless definition, and then the 21-day standard applies to the ESG program because that's the standard in the at-risk definition. I will say there's a lot of other stuff in the at-risk definition of homelessness, so there may be other ways that people qualify under that provision as well. William, we have a question about sort of the mechanics of the eviction moratorium. So first of all, if somebody does find out that their client is being evicted, what do they do? What steps can they take to prevent it from happening?
Yeah, great question. Can you hear me better this time, by the way?
Yep, much better. Thanks.
Great. So this is one of the reasons we encourage you to connect with legal aid. The jurisdictions are going to vary on how they implement eviction procedures. So legal aid will be able to walk you through that. Some courts are open. You can go to the eviction court to stop it. Some courts are not. When in doubt, actually, you can call the law enforcement. If it's an illegal eviction, and if they're your clients, it is an illegal eviction. You run the risk that law enforcement is not receiving this training, and they have no idea who falls under the eviction moratorium. So again, we would encourage you to connect with your legal aid to kind of bring the legal backing to any action to prevent evictions.
Great, thank you. And I just want to clarify something. So, because a lot of times in the COC program, there are different parties to the sort of a lease agreement, or different entities sort of engaged in this. So there's the program participant, who's the tenant of the unit, and there's the recipient of funding, who is paying the rent, or sometimes leasing and then subleasing to the tenant, and then there's the landlord. So the eviction moratorium applies to essentially all those parties, right? Like there's no sort of landlord program relationship that allows you to sort of get around the moratorium. If COC funds are paying for some of the rent, you can't evict based on non-payment of rent. You're nodding yes, so I guess I gave a nice summary. Yep. Great. We have some BA questions. So John, I wonder if I could turn this question to you. So this questioner wants to know more about how enhanced SSVF funding to support VASH, how is that going to work and interface with the local VA case manager and staff? Can you talk about how that sort of interplay works?
Sure. So the local HUD-VASH case manager would still provide the services. SSVF would really just be stepping in to provide the rental payment, so that way we can secure that housing for the veteran. But the services are still provided by the HUD-VASH case manager. They're still enrolled in HUD-VASH.
Got it. And are there circumstances where SSVF case management would come into play here, or is this really just about the financial assistance and the rental assistance?
We would expect it's just the financial assistance, unless there's some particular need for SSVF involvement that extends beyond what HUD-VASH can do, and there are some circumstances, even under normal conditions, where we might have a co-enrollment, for instance, need for legal services that SSVF can provide, or that there's some direct service that needs to be provided to household member. Those might be instances where co-enrollment is appropriate, and that would have to be handled locally between the HUD-VASH and SSVF teams.
Great, great, thank you. We have a question about both SSVF and GPD, so maybe John, if you could take the first crack at this question. So this is for households that have multiple members, some of whom are veterans and qualifying for SSVF, but they also have family members. So how does it work if, you know, say the veteran is in inpatient treatment, or you know, maybe even isolated from the rest of the household in some manner? How can they continue? Do they just continue SSVF like they normally would, assuming the veteran was there, or can you talk about how that works?
The way SSVF is structured, and this is at all times, not just during this crisis, is that when the veteran is enrolled, that household, whichever members he or she says is part of the household, is included in the services that SSVF can provide. If for any reason that veteran and that household and the household members are forced to separate, so for instance, the veteran has to go into the hospital, the veteran is leave the household for any reason, there's a separation essentially between the veteran and the household members. SSVF grantees can continue to provide services to household members, and that includes the full suite of financial assistance and benefits for up to a year.
Great, thank you. And Jeff, can you talk about the same scenario but for the GPD program?
Sure. So GPD is a little bit different with regard to the payment. So if a veteran and their family, let's say, is in a GPD program and the veteran goes into the hospital, throughout that whole experience, we're only paying per diem for the veteran. So the assumption is, on some level, the grantee is probably getting some other sources of funding to care for the family. As far under the new guidelines that we were just talking about today, so the veteran goes into the hospital, and they're gone for an extended period of time, the grantee is willing to continue to provide, you know, the hold the bed for the veteran. In this particular case, I'm assuming it's a unit that they're holding for the family.
Mm-hmm.
You know, we would continue to pay per diem, and as described in the follow-up that is required, we just continue to reevaluate that on a monthly basis so they can continue to be served. Great,
thank you. Moving back to HUD, so we had some questions about signatures, and I think what people are talking about is any document that needs to be signed by a program participant for participation in an ESG-funded program. I think this applies to COC really as well. But Marlisa, can you talk about for ESG, can people use electronic signatures? To what degree do things need to actually be signed in person, if ever?
Yes, electronic signatures are completely permissible, and you know, this is a time when that would definitely make the most sense. And we've also said yes to the question whether, if you can't do an electronic signature, if providers are getting verbal consent from clients for either, in filling out their forms, any forms, that would also be acceptable. But we definitely recommend that once the threat of COVID is over and you're able to meet in person or get a signature in person, that's preferable to any sort of verbal consent. But if possible, electronic signatures are preferred and definitely allowable.
Great, thank you. And Brett, on the COC side?
Am I allowed to just say ditto?
Yes.
The same thing applies to
Absolutely. Yes. Great. So we have a question about rapid rehousing programs in the COC or ESG program that are coming up on the end of their 2-year term in the program. And so the question is, can the term be extended or can the program participant be readmitted into the rapid rehousing program to prevent them from becoming homeless again? So Brett, maybe you want to take this question on the COC side and talk about can the term be extended, under what circumstances, et cetera?
Sure. In order for the term to be extended on either COC or ESG, we'd have to waive the 24-month requirement. It's definitely on our radar, and I would say stay tuned. We're putting out information and flexibilities as fast as we can. To readmit them to the program, you would have to make sure they were eligible again. So they'd have to meet Category 1, Category 2. So I don't think that's going to be the cleanest answer. I'd say stay tuned and also keep in mind homelessness prevention if they can qualify for that.
Great, thank you. We had a follow-up question about the digital signature, and this is totally something that I can see because I think this has happened to me every day this past couple months. So there's digital signature that's like an official digital signature, like Adobe has a function, and I think even Microsoft Word actually has a function where you have sort of a more or less official digital signature. And then there's like typing your name in an email or something like that. Can you, like when we say digital signatures, what are we saying here? Do we mean anything that's sort of an indication that a person intended to sign, or are we talking about like actual official digital signatures? Brett, I'm sorry, Brett, do you want to take that one?
Sure. Sure. I think when you're talking about official HUD documents, there might be a difference than when we're talking about like your grant agreement than when we're talking about what you get from a program participant. When we're thinking about program participants, we're thinking about anything that provides the intent that the program participant meant to sign it. So you could totally see like them writing something on a piece of paper that says, I agree to this document, and signing it and sending you a picture. We could have an email from them, and I think Marlisa said this, but if you can't get any of that from a program participant and they give you something over the phone that says, yes, I agree to this, document that in a case file, and then follow up later when you're able to meet with the client in person and have them sign it and like date it and explain why the signature is late.
Great, thank you. Somebody suggests that similarly, like attaching a JPEG of a signature to a document might apply, and it's the same answer. I mean, just like we're trying to be reasonable here. Do the best you can. Get the most sort of that you can, and then sort of once things are more reasonable, just try to like get actual signatures on things. But yeah. Oh, thank you, David. Just don't overcomplicate this. Just do the best you can. If you know this is what the person wanted, like document it, write down how you know, and put that in the case file. Great, thank you. Question, Aaron, about, and I think you addressed this partially, but I want to come back to this. So there's a waiver for limits on eligibility, limits on eligible housing search and counseling services. So what if somebody doesn't have this line item in their grant, but they want to take advantage of this waiver? Can you, so in this case, it's to provide rental arrears or utility arrears. Can you talk about then what's the step then if you don't have this line item in your budget?
Absolutely. Yeah. So first, what you would do is on HUD Exchange, we actually uploaded the most recent, the 2019 competition grant agreements. That those are up there, and what you would do is you would go to HUD Exchange, you would pull down the individual grant agreement for your specific project, and then you would make the adjustments in the form. It's there, the wording is all present. You fill that out, you sign it, you send it to your local HUD field office. These instructions are all on HUD Exchange, as you'll see. You send that to your local HUD field office, who will then review it. And once it's been approved, the director will sign. They'll make changes in the lock system. These changes are limited, time limited to the duration of the grant year, not to exceed 1 year, right? And they won't carry forward after that. So these are just for COVID-19 related amendments. But again, it would be reviewed at the field office, and you can find, I think we'll find the link and put it up there for everybody, so that you'll be able to find your individual grant agreements.
So I just want to be clear about this, because I think this is kind of an unusual approach to this. And I want to thank the team, Aaron, and everyone who you worked with on this, because this is kind of extraordinary. But we have a template of every single grant agreement that's on the website. So we have 7,000 grants. And so there are 7,000 grant agreements, template things out there. You find yours and you just put in the numbers and send it in, and that's the amendment process. So we've tried to really streamline this and make it as simple as possible. And so that's how it works. We will dig up the link to that and post it on the chat box momentarily. So thank you, Aaron, for clearing that up for us. Sorry, I was not paying attention to the questions coming in. So we have a question about, William, I wonder if you could take this question about the eviction moratorium. So the past due fees for the moratorium period. So after the moratorium is over, can a landlord sort of go back and at that point apply all the fees that they didn't get to apply while the moratorium was going on?
Great question. So to be clear, the rent is still due. That's something that there's been a lot of confusion about. So during the moratorium, it doesn't mean no rent is due. However, during that 120-day period, there can be no rental fees or charges or anything tied to the non-payment of rent. So a landlord can't go back 120 days or after the moratorium ends and say, oh, well, you didn't pay rent for the last 120 days. Now you owe me a bunch of fees for that. Nope, that moratorium on those fees exists even after the moratorium period, as it applies to anything that they would have incurred during that 120 days. So from March 27th through July 24th.
Great, thank you. And we did have some people earlier ask about whether they could see sort of documentation from HUD that this applies to the ESG and COC programs. I know that it was posted in the chat earlier in the chat window. There's sort of a fact sheet and Q&A kind of document posted. So go ahead and just check in on that, and you can have sort of that documentation and proof that that applies. So question about ESG and back rent and forward rent. So Brett, I know you've taken this question before, but can you talk about, so can people can you pay for both rental arrears and rent assistance going forward? And I know there's a different answer for ESG and COC, or I think there is. Can you talk about it first in the COC context, and then talk about like how does that intersect with a 24-month limit on rental assistance?
Yep. For both programs, someone has to be eligible for the program, so you just can't willy-nilly pay back rent and front rent. For the COC program, if somebody's eligible for, let's say, rapid rehousing, then you can pay rent going forward for up to 24 months, depending on your local standards. One of the waivers that was in the big memo that was published allows you to actually seek a waiver to pay for rental arrears under the COC program, and that would allow you to pay for 6 months of somebody's rental arrears if it's preventing them from obtaining housing. So if you have the waiver, you can pay for rental arrears in the COC program. For program participants, you can also pay for rental assistance going forward under rapid rehousing or PSH if someone's eligible for the program. Under ESG, you can pay for up to 6 months of arrears, and you can also pay for rental assistance going forward under rapid rehousing and homelessness prevention. But correct me if I'm wrong, Marlisa, if you pay for rental arrears, that does count towards the 24-month maximum that you can receive in any 3-year time period under ESG.
That's right.
Great, thank you. So we have a couple questions about execution of fiscal year 2019 COC grant agreements. And some people are still waiting for their grant agreements. I want to give a quick update on that. If you were sort of a tier 1 recipient that was not sorry, how do I say this? Either a consolidation or expansion project or a straddle project, then field offices have been working on executing those grant agreements. If you are a tier 2 renewal recipient that is not a consolidation or expansion or straddle project, probably next week, starting at the beginning of next week, field offices will start being able to execute those grant agreements. If you are a project that was awarded as an expansion or a consolidation project, there's some more work that on our part to get those done. So that's probably early May that we'll be executing those grant agreements. Another question on timing we have is about will there be more waivers for ESG, more ESG flexibility, and a similar question related that's about when can we expect more to learn more about CARES Act funding in the next allocation. So with respect to additional waivers and flexibilities, I think Brett sort of alluded to this on a couple occasions, but we are continuing to work on additional waivers, different flexibilities. We will keep publishing things and notifying you as we get them. We're working on a couple things right now. So I don't know what exactly the timing is, but it's definitely, in the, week or two range, not the, not sort of a longer time frame. And with respect to much more information about the CARES Act funding, including the next allocation, I don't know the time frame for that, but I will say that we are working on a lot of sort of bigger flexibilities and things for the CARES Act funding, the ESG CARES Act funding. Also, we're working on sort of figuring out what applies to which ESG program. So if you got, say, fiscal year 19 ESG funds, which of the waivers and sort of additional flexibilities that we're going to announce, which of them apply to that funding, and same with fiscal year 2020 ESG allocations. So we're working on all those things, and again, I think we're looking at weeks, not months, but we will definitely keep you updated on all of that stuff, and it's it's definitely worth making sure you're subscribed to our listserv to make sure you can get that information as quickly as possible. So with that, we are at the end of our time. I will say that want to thank our speakers, all the TA providers who have worked both on the logistics of this session and working with communities on just figuring out how to respond to COVID. Definitely want to thank all our COCs, our recipients, our partners in this. You guys are doing amazing work, and I just can't imagine how challenging it is to be working in this environment. And just want to thank you all. You're doing incredible work out there, and you deserve way more credit than you're getting for all of this. So just know that we in the SNAPS office just 100% appreciate how hard you're working on this. So with that, I hope everyone enjoys the rest of your day. Hope everyone has a nice weekend, and that concludes this webinar.